Hello, dears. Hi, good morning. Hi, Abhilash. Hi, Sinkani, Sudarshan, Adarsh. I'll let you know. I mean, like, you can let me know when are your free days. Like, it depends upon, I know it shouldn't be only according to my convenience, right? I have to look into your free days. You guys are even more busy and thickly packed than me. Actually, I'm traveling due to some unexpected, unforeseen things came up and I was traveling. So the thing is, let me take a disclaimer. Sometimes the voice won't be good because on the way I stopped somewhere to start the class, and because of which I think sometimes some external voice might be there. I'm so sorry. Uh, I mean, everything is good. I'm not sure about the connectivity. I mean, nothing like it's not a controlled environment where I'm sitting. I'm right now sitting in an uncontrolled environment. Nothing is within my control. Hi, Umesh, Matthew, Prakar, Nikhil. Okay. Okay, guys. So let's start. Kirtana, Malika. All good now? How was the exam? How was the exam? I know there were few unexpected questions. I gave you a heads up that you have to expect the unexpected as well. But majority of questions, I would say around 95 questions were from, uh, if I take class from Mars, you want me to go to Mars, huh? Okay, silly mistakes. 85 others, it's not bad. I mean, though I said these are very silly, I mean, easy questions, those were, things that you can expect. And majority had messaged me, madam, good questions. So I don't understand what does good means, easy or difficult. Anyway, guys, so let's move on to the topic. Uh, Honestly, even my iPad is not working properly because, like I said, I was traveling. Uh, Give me 1 minute. No worries, Adarsh. Haven't I told you, this is the right place where you can make mistakes. And once you commit mistakes, you will always learn from your mistakes and you will never ever commit it again. So when the real exam is there, you will, it will be within your grip. No worries. Okay. So what did you write here? Let me see whether my pen is working. Yeah, kind of it's working now. Shall we? Yes. Hi, Chitul. Lots of mistakes. Vivek, it's okay. I'm here to remove all your queries and mistakes. Look at this, guys. This was something, relatively new. It's a case of pulmonary TB, and the patient is resistant to INH and rifampicin. We know INH and rifampicin resistance is MDR, that we very well know. And here it is also said that along with when they look for further testing, they found that the patient is resistant to levofloxacin as well. So what do you call it as? 15 wrong, but realize it's okay, Rahul. No worries. So this is MDR TB, INH rifampicin, right? Along with that, the patient is also resistant to fluoroquinolone. So I have told you RR or MDR plus fluoroquinolone is XD. It's pre-XDR, right? It is pre-XDR. So here the answer is pre-XDR. Okay. Now the question is, from pre, you go to XDR, right? So from pre, we are going to XDR. Pre plus something extra is XDR. What is it, guys? Pre-XDR plus if the patient is resistant to any of the additional group A drugs, right? So if the patient is resistant to either linezolid or bedaquiline as well, then you call it as XDR. So here the answer is pre-XDR, right? And pre-XDR is nothing but extensively drug resistant is XDR. Okay, multi-drug we have already seen. Polydrug means the patient is resistant to more than one anti-TB drug. Okay, more than one anti-TB drug. But it may not be the combination of INH rifampicin. If INH rifampicin combination is there, that naturally becomes MDR. Okay, I hope it is clear. Okay, so we have pre-XDR, we have XDR, as well as multi-drug resistant TB, which is MDR. Okay, yes. Moving on to the next simple question. A 23-year-old intern, you all might have come across such a situation somewhere in your batch, right? Pricks a finger with a, we usually see it with the interns. That's why I gave that question. Okay. From an HIV positive patient. Then the intern will come running to the department asking, Madam, what to do now? What to do? You have to take post-exposure prophylaxis because you are damn sure that the patient is HIV positive. So the regimen is TLD, tenofovir, lamivudine, dolutegravir, right? So that is a PEP required. Now, when to start? Ideally, we have seen within 2 hours, but not after 72 hours, right? So ideally within 2 hours, but before 72 hours. And you have to give it for 28 days. So we have seen on, right? Okay. Moving on to the third one. What was this? Okay, a patient has never taken any anti-rabies vaccination. Okay, so what to write there? There are multiple bleeding puncture wounds, which are the following will be the answer. Showing your internet connection is unstable. I'm so sorry. Like I said, I'm traveling. I'm not in a controlled environment right now. I found a place to sit. That's it. What is the answer? It is yes. Correct. Correct. Benita. Correct. Malika. I'm sure the initial ones you could have got correct. It is HRIG or ERIG, whichever you want, you can give. Okay. And along with that, you have to give. See, this is definitely category 3. I'm not going to the details of category 3. We have seen it already. Okay, this is definitely category 3 because I've told you whenever bleeding present, it naturally or automatically, I would say, it becomes category 3, right? So for category 3, we have to give vaccination plus immunoglobulin. Here the vaccination is thigh regimen vaccine, intradermal vaccination. So it is 0, 3, 7 and 28. Whereas had it been intramuscular, we know 0, 3, 7, 14 and 28, which you call as essence regimen, right? All these are just to brush up your memories. Okay, I know it's still there in your brain, but just in case something goes here and there, just to put it back. And it is intradermal thigh, right? And it is HRIG. Guys, I said HRIG. So do we have any other IG, immunoglobulin? Do we have any other immunoglobulin? Do we have any other immunoglobulin? I said human. Correct, Benita, correct, Irshana, Kiran, correct, Adarsh. Okay. So all of you are correct. We have HRIG and ERIG. HRIG is the one that is taken by human. It is human rabies immunoglobulin, whereas this is equine. Equine means you are taking it from horse. So the problem is hypersensitivity might be a problem. So we have to first test for hypersensitivity before giving the medicine. That is the first thing. And see, there's a slight change in the dosage as well. This also you can expect as an MCQ. Guys, here in this particular session, I will also be discussing certain things extra. Okay, I've already told you because in that 1-day class, apart from that, I'll also be discussing something extra. This is the extra one. ERIG is 40 international unit per kilogram body weight, whereas HRIG, utna nahi chahiye, so it's less, 20. Can remember for your exam as MCQ. Okay. Then we have the next one. Somewhere we had discussed this. Okay, a traveler from India is preparing for a 3-week trip to Nigeria. Okay. An area which is endemic for yellow fever. According to the international guideline, guys, sometimes they may not give it as yellow fever endemic area. Okay. For, to make it easy for you, I gave it as yellow fever endemic area. But you should understand that, Nigeria is a place where yellow fever is more. According to the international health regulation, which of the following vaccines should be administered? Yes, all of you are correct. It is 17D vaccine. 17D vaccine. Okay, so 17D vaccine is the one that we give for yellow fever. Okay, what else you know about the vaccine? See, once you give this vaccine, so any patient, not patient, any person, any traveler who is planning to go to the areas which are endemic for yellow fever, like, sometimes North America, then, African countries, they have, my voice is breaking. Sorry, like I said, I'm traveling. I was not expecting this travel. I had to travel all of a sudden. Okay. Is it okay? Are you able to hear me? Are you hearing? Okay. Okay. So, yellow fever vaccine, the name is 17D vaccine. It is a live vaccine, given as sub-Q, 0.5 ml. And how many times you have? See, after you give the yellow fever vaccine, the immunity starts only after 10 days. Okay. Suppose you are planning to go today, you should have taken the vaccine 10 days before. Otherwise, the immunity will not be there. Okay. So you have to give it before 10 days of travel, and it has immunity for how long? It was 10 days earlier. Now it is lifelong. So you just need to take it once. The people who are, especially the navigators, people who are working in ships and all, earlier they were asked to take, every 10 years. I mean, I personally know many people. So they were coming to our hospital and they were asking, okay, the last one was taken 10 years back. But now it has become very easy. They just need to take it once. Okay. Lifelong. So these are the other MCQs that you have to remember from this. Click our old vaccine for COVID, right? This one is for rubella. And Cervarix is for which vaccine? That is for HPV. That means for preventing CA cervix. And this Cervarix is Indian vaccine, right? Indian vaccine, which is quadrivalent vaccine. Okay. Okay. Yeah, 10 days before, at least 10 days before the travel. Doesn't mean that exactly 10 days before. That means once you have taken, Jitun, once you have taken the vaccine, only after 10 days, you are supposed to travel. That's what I meant. Okay. This was a question. Okay, I want to hear from you. What did you write? It's, to be very honest, this is a previous USMLE question. It's a previous USMLE question. In my classes, in my regular classes, I have discussed this many times. Actually, the name was not Geeta. I changed the name to Geeta. 75-year-old Geeta had type 2 diabetes mellitus since 1979. She developed diabetic nephropathy in 2004, which finally resulted in acute renal failure on September 2014. She had developed cardiorespiratory arrest and died on 7th. Okay, she had a BMI of 32. What is the correct answer? Confusion between? Okay, let me see. This time I'm checking your chats. Yes, you made it wrong. Okay. Guys, listen. First you listen. Okay, by now you know what is the answer. Let me tell you, this is a question from International Death Certificate. Okay, for those who have not seen International Death Certificate, I'm going to show you because you can expect MCQs from International Death Certificate. I'll be just telling you the MCQs, so just sit back and listen. What are the MCQs? First, you listen. I answered C, even though I knew. Oh, even though you knew, then why did you write C? Okay, so see, what you see here is the International Death Certificate, which you can expect as an image-based question. This is an International Death Certificate. This is the one that we are following all throughout the world. That means internationally, this is a globally accepted International Death Certificate. And as you can see, here it has got two parts. Part 1, Part 2. Okay, Part 1 deals with the causes of death, which are again divided into, as you can see, A, B, C, D. Right? Part 2 deals with, that is the next MCQ, significant condition. Significant condition means some other disease. Okay, significant condition means it could be some other disease, but which could have contributed, which also could have contributed to the cause. Okay, some other disease that would have indirectly contributed to the cause of death. Okay. Now, see, part 1 deals with causes of death. Now, we have different causes of death. One is known as, in 1A, you write immediate cause of death. Immediate cause of death. Immediate cause means something that would have, directly led to the death of the patient. Okay. Second, in part B, you write, again starting with I only, but intermediate cause of death. It is intermediate cause of death. Okay. And in C, you write the underlying cause of death. Underlying cause means the intermediate means something which would have triggered the, something which would have triggered the immediate causes, intermediate. And in part C, you are writing the underlying cause of death. Underlying cause. That means the disease that could have led to the death. The disease that actually started the whole, chain of events. Okay. Now, I'll give you one example. Imagine that there is a chronic diabetic patient. Okay, there's a chronic diabetic patient. He developed, let me just write it here. We have a chronic diabetes mellitus patient. He developed diabetic nephropathy. After a long time, he developed diabetic nephropathy. Then he developed renal failure, got admitted in the hospital, and he died of renal failure. Okay, definitely due to cardiopulmonary arrest. I am going to ask you a question. Guys, this is the condition. He was admitted and he died of cardiopulmonary arrest. What is the immediate cause of death? I'm asking you. Who answered last? Oh, you guys are... See, still I am getting cardiopulmonary arrest from many. I knew it. Majority would go for cardiopulmonary arrest. That's wrong, guys. What do you mean by cardiopulmonary arrest? Cardiopulmonary arrest means you are dying when your heart and lung stops, right? When your heart and lung stops, can you call it as a cause of death? That is a mechanism by which anybody is dying, right? See, this is a mechanism by which everyone is dying. You cannot call it as cause of death. Are you understanding? So cause of death here is, that means immediate cause of death is renal failure. This is the immediate cause. Okay. And intermediate cause here was intermediate. That means something which triggered renal failure was diabetic nephropathy. And the disease or the underlying cause, the disease that has led to this is diabetes mellitus, right? So you call it as all people die of exactly. All people die with cardiopulmonary arrest. Yeah, that's what even I said. Okay, so here the disease which started the whole thing was diabetes mellitus. So you call this as a case of diabetes mellitus. This patient died of diabetes mellitus, right? Now, guys, let me just take you back to this. Here, in 1A, you will write what? You will write renal failure. In 1B, you will write diabetic nephropathy. And in 1C, you will write diabetes mellitus. So this patient died of diabetes mellitus. Just imagine that he also had hypertension. Okay, imagine that he also had hypertension. Hypertension also would have contributed to renal failure, right? That's a different disease. Okay, but that also would have contributed to death. So under significant condition, if he had hypertension, you will write hypertension as well. Are you with me? If he had some other skin disease, you won't write it. So don't think that any comorbidity you can write in significant. It's not like that. Okay? I hope it is clear. Okay? So if the question is, the patient died of what? It is a case of diabetic death. So the next point that I want to tell you is, usually what you write in 1C or the underline is taken as the original cause of death. You have to pick something from this, right? The patient died of diabetes. So cause of death will be usually taken as what you write in 1C, because of which 1C is known as Next MCQ, very important, essence of death certificate. So you can write that as well as an extra point. This is known as essence of death certificate. Okay. Yes, Irshana. Yes, correct. You're asking correct? Yes, it is correct. So we have discussed one extra topic with the help of this MCQ. If you have got it wrong, it's okay, because this is, like I said, it's a high-fi question. High-fi, really high-fi question. Do one thing, you take it. Anyway, it's a roast, no? See, we are seeing that as a positive thing, you know? Someone is coming, anyway, with an offer. Something inevitable, so take it gladly. That's what. Okay. You don't have any other doubt, right? Only with the rose. If baki, sab theek tak. Okay, so 5-year-old child has received all vaccines across. This is very, very simple. A 5-year-old child has received all the vaccines appropriate for age up to this point, according to National Immunization Schedule. The child now comes to immunization clinic. These are the following vaccines will you give? Oh, okay. Nothing to discuss here. We have discussed it in and out, right? What to give, how to give, which all should be given till 1 year. All those we have discussed. And this is a very clear-cut question that you are getting. But I have some other complicated questions as well coming from UIP. I've kept it aside for the coming slides. Anyway, here the answer is definitely only one thing left, which is DPT booster 2. Oh my God, my pen again, charge is less because I was traveling. Okay, next. Okay, this, I think I don't have to tell you. We have already seen what all to be given during birth, 610, you know, iPhone Pro. Don't you remember all that? Huh? Then Michael Jackson for MJ going together. So many tricks we have already learned. Okay, next. A 40-year-old man presents with bilateral pitting edema of legs, diarrhea, edema, and dyspnea. Several others in his locality developed similar symptoms after consuming. Here also I have given the direct clue: mustard oil from a local vendor. Which of the following toxin is most likely responsible? Yeah. Sang with mustard and argemone. Oh, nice. Yes, it is sanguinary, which is T. I'm sure everybody would have got it correct, right? So we have the clue here. I said sanguinary. This is, by the way, what is the condition? Yeah. What is the condition? Dropsy. This is epidemic dropsy, right? Epidemic dropsy. And what was the clue that I gave you? Drops are caused by two things. Correct. Oil, water, right? And I said it is caused by an oil. Which oil? Argemone oil, which is not mustard oil. Mustard oil is good. When mustard oil get contaminated with argemone oil, don't blame the mustard oil. Poor thing that you can eat. Argemone oil. Then it becomes toxic because this has got a toxin which is sanguinary, right? And what is the clue about water? The manifestations will be in the form of excess water in the body, right? Like diarrhea, you know, cardiac failure will be there. That is by dyspnea, bilateral pedal edema. Then, you know, sometimes the patient will be having glaucoma, all those things. Okay. Okay. Moving on to the next. Let me ask you one more thing. This causes what? Virological alkaloid? I said A and A. Ascites. Endemic ascites, right? This causes endemic ascites. Ergotamine. Ergotamine. Yeah. Saint Anthony's fire. Saint Anthony's fire. Which is ergotism. Okay. Also known as Saint Anthony's fire. caused by rye or, sometimes, bajra, like you said, burning sensation. Aflatoxin, look at this, guys. Aflatoxin it is caused by aspergillus. Okay, it is a storage fungus because when you keep things in store, if the moisture content is not correctly managed or controlled, then you can get aflatoxin. Okay, and is a hepatotoxin caused by B1 and G1. So we have covered all the others as well. This is the next one. A 28-year-old man presents with single hypopigmented skin lesion. So first thing that comes to our mind, maybe could it be POSI? Let's see. With loss of sensation and no. It is thickening of ulnar now, right? Okay. Skin smear, negative. According to the NLEP, what is the appropriate treatment? Guys, there is a change. Had it been few months back, this would have been POSI, right? Had it been few months back, that is exactly why I gave this question. Okay. If it had been few months back, we would have thought of POSI. Now it is. Oh, you thought POSI. That's what. You are few months back, Jitun. Come to present. It is multi. Yes, it is now. Beyond doubt, we know it is multibacillary. Multibacillary. In multibacillary, you have to give, 3-drug regimen for 12 months. So you have to pick the one that has got 12 months. We have only 2 which has got 12 months. So could be sometimes A, sometimes B. Now, which is which? I know every faculty might be asking this question. You're so much familiar. Now, just wait it for your NEET exam as well. Okay, so what is the answer? Yes. Anyone positive. That is why you call it as cardinal symptom. Okay, I don't know what to call your name as. AIMS MBBS exam. Okay, so here the answer is A. Rifampicin, once monthly, clofazimine 300 milligram monthly, dapsone 100 milligram, clofazimine 50 milligram for 12 months. Now, for those who are not very sure about the drug regimen, guys, please have a look at this. For paucibacillary and multibacillary, it is the same now. Now, I'll just try to teach you how to remember these medicines. Guys, listen. First, think about rifampicin. Now, I want you to listen. Rifampicin is given as once monthly for 600 milligram. And next, you think about dapsone, because when in POSI, it was only R and D, right? So dapsone is given daily as 100 milligram. So first, you remember this R and D. Okay, RD. First, you remember RD. R 600 milligram monthly, whereas D 100 milligram daily. Okay, you don't have to, usually they don't ask about schedule. No worries. Okay, I haven't seen any question. Now, clofazimine is the third drug, right? So to remember the dose of clofazimine, you can always relate it to what you are giving for rifampicin and dapsone. Half of that. Okay, half. So remember, guys, clofazimine. Oh, sorry. So clofazimine is half of this one. So rifampicin is 600 that you're giving monthly, right? Half of that. That means, where is it? See, monthly 300. Are you seeing? Dapsone, we are giving 100 milligram. So half of that, 50 milligram every day. Yeah, expected question, Vivek. Hope you got it correct. And, 1.5 years back for INI, this question came. Okay, 2 drug kits were shown. It was A and B. These were named as A and B. And the question was about paucibacillary. Actually, the question was about paucibacillary. And the question was, which among the following will you give? Back then, the answer was kit A for 6 months. But guys, now don't think about this one. We have only the red one, which is for multibacillary. Okay? And look at this. This is actually rifampicin. See, this is rifampicin. 300 milligram. So 300 plus 300. Are you understanding? So this is rifampicin, 300. Whereas this is clofazimine, 100 milligram of clofazimine. 100 milligram of clofazimine. So 100 plus 100 plus 100. 300. Okay, once you see and once you learn, it will be there in your brain forever. That's why I'm showing you. Okay. And then we also have, see, this is Dapsone, 100 milligram. And this is clofazimine, 50 milligram. Okay. So this is how you take it. Are you with me? Did you learn? Did you learn? Treatment for POSI, same thing. SSS, same. Only thing is that for POSI, you are giving it for 6 months, and for multi, you are giving it for 12 months. Okay. Same drug for POSI, 6 months. For multi, 12 months. There shouldn't be any doubt. And even I am also expecting a question either in NEET or INI. Because it's a update that has come. So you can expect. Next is a patient presents with painful genital ulcer. Clue is there. This time for every question I have given clue. Painful genital ulcer on evaluation. Smear from the lesion was multinucleated giant cells. According to NACO syndromic approach, which among the following will you give? UVG3 lab. Red. I said ARDS, Vivek, not red. Red is. Oh, okay. Red from the. Okay. G3 lab, ARDS. Okay, so this is red. Do I need to tell you? You know it, right? Okay. The latest one. Okay. So to how to remember, I think I don't have to tell you. No, you have to close your eyes, and we have already discussed. Here it is. Look at the clue. Smear. So naturally, that is, we know, herpes simplex, herpes virus infection, right? So this is the one, and the one that we give for herpes is red. And which is the medication? Of course, if it is herpes, naturally that will be acyclovir. Nobody will ask you what you have, like, but you can remember. I've seen questions from this one. They ask about green. Usually they ask about green. They ask about red. I think net connectivity is an issue. So sorry. So I right. Okay. So you can remember, like, you know, what you give for red. My red cycle. You can remember my red cycle. That means acyclovir, red cycle. Okay. Do I need to tell you? Do I need to tell you? I think it's okay, right? You know, when you close your eyes, this is how you remember, right? Gray. Close your eyes, and when you are below the earth, right? From there, go up, green, then white, little up, blue. So it's just a recap. Okay, that's why I'm not going into the details. Then it's becoming evening, so red, yellow, black, and again in the morning it is brown. So these are the 8 kits that you have to remember color coding. And here it is UV 3G, right? 3G. And 3G is, all these 3 are genital ulcers, right? We have already discussed many times. This is genital. These first two are genital ulcer, non-herpetic. This one, a patient who is sensitive to penicillin. This is a patient who is resistant or sometimes, allergic to penicillin. Whereas red is genital ulcer herpetic. Okay. Then lab. LA, lower abdominal pain. B is inguinal bubo. And I said this is ARDS. That is anorectal discharge syndrome. Right. So we have seen the how to remember all this. And I've also told you ARD, since the brown one is a new one, you have to remember it in detail. Okay. So what is the clue? A, B, C, D. With A, you have anorectal discharge. B is brown. C and D are the drugs, cefixime and doxycycline. And the dose and everything you are seeing here. Okay. What is the? Of course, you will say. Who is she? Who is she? There is a she and a he. Okay. She is Pragati. Correct. Who is he? He is Vikas. Okay. So we have Vikas and Pragati. Both are the enumerators, right? For Census 2027. They are the enumerators for Census 2027. So Pragati is the female enumerator and male enumerator is Vikas, right? Okay. And who Sapna? Sapna is the mascot for leprosy. That also we have discussed last day. Then who is Usha? Urban social health activist. So she is acting as a link between UPHC and urban slums. That also we have seen. Okay, so she is catering to a population of 1,000 to 2,500, all those things. Suman, we will discuss Suman after some time because there are some questions coming about Suman as well. Okay, Suman is from RCH, you know. Now, match the, we don't have that much time. So, match the health-related indices with their correct core components. What is the answer, guys? Which one did you write? This also we have discussed. What is the correct answer? Is it stuck? I'm worried it is stuck. Okay, Ilkil, Vivek. What is the answer? Ilkil? It's A, right? It's A. No, I have to see. Human Developmental Index. HDI. See? This is your kill. Are you seeing? Income. Education is K, knowledge. Life expectancy at birth. Right? PQLI, I said ill. Where is ill? Where is ill? This is ill. Are you seeing? Ill. IMR, literacy, life expectancy at 1 year. Now, what is DALI? Years of life lost. This is a disability indicator, right? I said YLL plus YLD. I will kill. Ill kill is a lifesaver. Ill kill, even when I was doing my, when I wrote my entrance, back then itself, I was thinking about this. Even all these mnemonics had helped me when I wrote my exam. Okay, so B is, see, DALI, years of life lost. So this is C, years lived with disability, right? And HALI is expectation of life lived in full health. That means how many years someone will live in perfect health. How many years someone will live in perfect health is HALI. Okay. Again, match the following. Oh, so simple, match the following. What is it, guys? What is the answer? Yes, Abhilash. Yes, yes, yes. There shouldn't be any confusion, Abhilash. From April 2025. Okay, from April 2025, we are using the same drug of 3 combination, RDC. Only difference is for POSI 6 months, multi, we are giving it for 12 months. Yeah, it's big. Okay. So primary prevention in the pre-pathogenesis phase. Which one will you do as primary prevention? It is under primary prevention, we have health promotion and specific protection. Right? So which one? This one. right? This is pulse polio immunization is coming under specific protection. All these are MCQs. So you can even expect MCQs from this. Then under secondary, we have screening, right? I said SET. Under screening, I said SET, S-E-T. What is it? That is a mnemonic. Screening, early diagnosis, treatment. Don't you remember? Okay, SET. No, HS, SET, doctor. Okay. So even the mnemonics, I think I need to recall like this. So which one? Screening. No doubt. So this is 2. Then tertiary, of course. Disability limitation and rehabilitation. So there is no doubt. This is tertiary. Primordial prevention. Legal steps to ban tobacco. Okay. So you can either health educate or you can even take legal. But that means you are removing the emergence of risk factor. Because this is a risk factor and you are taking the risk factor out. You're removing the risk factor, that means that becomes primordial. Okay. He has set a doctor. Yeah, even that works. Thank you, Vivek. He has set a doctor. He has set a doctor. Okay. I think that is better. Thanks. After major flood, the district administration enforces strict building regulations in flood-prone area and relocates settlement away from the river banks to reduce future damage. What is it? Ah, yeah. Mitigation. I don't have to tell you what is mitigation. Something similar we have already seen. Right? So these are the phases of disaster management cycle. No others. Future damage, actually, that's what I'm coming to it. See, if you're taking actions to mitigation, that's why I told you, you have to remember the word meaning. Mitigation means to reduce or to lessen. Okay, reduce or LESSEN, lessen the impact. So whatever, those infrastructures, those things that you do to reduce the impact of disaster is actually coming under mitigation. So, you have some rules regarding, how to build a house if it is a earthquake prone area, if it is a flood prone area, all those, infrastructure things that you see is coming under mitigation. Whereas here you are preparing, like I said, you are preparing the people as well as the health system. So rapid response team building, then what did I say? Mock drill. All those things are coming under preparation. That means you are prepared to fight against it. That is what it means. Okay. So the first phase, I think I don't have to tell you. Whenever a disaster strikes, what is happening? It's a response phase. Okay. Response phase where you are doing triage, tagging. Haven't I told you? I think I don't have to write again. Okay. Tagging, transport, treatment. I said there are 4 T's coming under response. Then under recovery, as the name indicates, you are, trying to recover that area as well as the people. So rehabilitation, all those things. Mitigation, we have already seen. Preparedness also, we have already seen. Okay. So ideally, you have to start from here, is what we say. Ideally. Now the books are saying that ideally you have to start from mitigation because we were not expecting as many disasters earlier, but nowadays a lot of disasters happening. So we have in-depth research going on in research. I mean, in disaster. Okay. So here it is, mitigation. What next? Another new question. I want to know whether you could write it. Yeah, Churalmala incident. Yes. It is spikes. Okay. So this is spikes approach. Okay. So 55-year-old man is diagnosed with metastatic carcinoma. The doctor is breaking a bad news. The question is, what is the protocol we have for breaking bad news? See, once you start practicing, then you will realize that you just cannot break bad news. Just like that, you can't tell the patient. Okay. So there comes the importance of, your emotions, your attitude, how you communicate with the patient. So we have a protocol, which is known as Spikes protocol. Okay. Spikes protocol, as the name indicates, has got mainly 6 steps, starting with SPIKES. What is S? The setting. P, the perception. my eye pencil is not working. That's why I kept it aside for charging. Then invitation, K is knowledge, empathy, summary. Now I'll tell you what it does. No worries. Look at this, guys. See, S means setting. That means you have to ensure privacy. It shouldn't be, just coming out of the hospital and telling it on the face. It shouldn't be like that. There has to be, you have to, the setting where you are going to open is something important. No. They can ask full form in the sense what is S, what is P, what is I, that they can ask maybe. And I've seen questions coming. Okay, what is P, what is I? That's what I'm showing you. Perception means you see what the patient already knows. Okay, is the patient aware that okay, something is wrong? Or is it something new that they are going to? Okay, so accordingly, you have to plan everything. Then invite, determine how much information they want. Okay, sometimes they may be, not that much educated, so you can't tell them everything. And deliver information clearly. Then you are imparting that knowledge. Naturally, the patient will start crying. They will sometimes burst into tears. Then you have to ease emotion with empathy. See, respond to their emotion. Okay, you have to make them calm, touch them, okay, pat at their back, whatever. You have your own ways of tackling the emotions. And then you say, okay, what can be done? That is the strategy summary. Okay, once they are calmed down, you tell them, okay, now don't worry, we have a solution for it. So let's see what we can do together. Okay. So this is SPICE approach. Okay. Now, gather approach, I'm not going into the details. Gather approach is for counseling. It is for counseling. Okay. For counseling. Delphi method is for reaching a consensus, for getting single answer, or to reach consensus. This was the MCQ which came. Okay, consensus from a group of experts. I have explained this in detail in the original class. Okay, you can refer to the video. I know you all have access to video. Consensus from a group of experts. Okay, Johari window is, it's a type of communication of, self-assessment. Don't ask me what it is now because I don't have time for all that. Okay. Joseph and Harry. Okay. So they together made it. Anyway. Now, which of the following is true for iron prophylaxis as per the National Iron Plus Initiative? What is National Iron Plus Initiative? Nothing but Anemia Mukt Bharat. Only one is correct. Yes. The answer is A. A tablet containing 60 milligram of elemental iron and 500 microgram of folic acid given weekly for 10 to 19 years. Okay. So you guys gave me that how to remember the color. You said uniform, right? Blue color tablet. So we are talking about that blue color tablets. Uniform of adolescent. But I said I differ because mine was maroon and white. Okay, so this is blue tablet. And I think I don't have to tell you. Okay, this is as per the Anemia Mukt Bharat 6x6x6 strategy. There are 6 beneficiaries, then 6 interventions, 6 institutional mechanisms. And these are the 6 beneficiaries. And I said, out of the 6, 2 are children, 6 months to 5 years, 5 to 9 years. 3 are adult females, women of reproductive age, pregnant, lactating women, right? And 1 adolescent. Okay, and I said 1, 2. Instead of 3, 4, I'm going to write it as 4, 4. I said 3, 4. Then thereafter it is 5, 6. So those you remember, right? Okay. You already remember all that. And I said for small children, we are giving syrups. So it is weekly twice. Sometimes as children may spit it out. For pregnant and lactating, we already know, starting from second trimester, daily 180, 180. Okay, antepartum, postpartum. That also we have seen. For all the others, it is weekly once. Okay, and for females, we are giving because they are bleeding. Bleeding color is red. So for all, every female, it is red. Whereas for adolescent, it is blue. And for children, pink. Children means 5 to 9 years, it is pink. All those we have seen. Right? I don't have to tell you what is this 1, 2, 4, 4, 4, 5, 6. Okay, all those we have learned. May I go to the next? With your permission, may I go to the next? Okay, moving on to the next. For a population of 10,000, a sex ratio of more than 1,000. I had told you more than 1,000 means females are more than males. Right? Okay, so that heads up worked, right? Okay, more than 50% are, yes. Because I gave heads up because this kind of questions always come for the exam. Okay, the application part is more important. You know what is sex ratio, but when it comes to application, you'll be like, oh my God, what to write? No such confusion. Sometimes they'll say more, sometimes they will say less. More means more than 50% are females. Here it is 10,000. So 50% of 10,000 is 5,000. That means females are more than 5,000 here. So females are more than 5,000 is what it means. Females are more than 5,000. Because it's more. Sex ratio more means more than 50% females. So naturally males have to be less than 5,000. That is the answer. Okay. And sex ratio, you know, number of females. Do I need to write per 1,000 males? All those people. What did you write here? What did you write here? Ah, all of you got it correct. Wow, nice. Good, good, happy. Yes, Devika, Sonia, Arav, Ishana, all of you got it 10? Oh, good, it's 10 only. So here, the question is about Pearl Index. Now, what is Pearl Index? To know the contraceptive efficacy. Okay, or efficiency. How good is a contraceptive is measured using Pearl Index. Okay, next, there is a formula for Pearl Index. What is it? Number of accidental pregnancies, number of accidental pregnancy, means unwanted or unexpected, divided by months of exposure. Months of exposure into, what is that number? Who will tell me? Ah, correct, Malika. 1,200. By the way, what is this 1,200? It is the number of months in 100 years. This is the number of months in 100 years. Okay. Now, here the concept is that, guys, listen. If a woman is exposed to the risk of pregnancy for 100 years. Okay, just an imagination. Okay, if a woman is exposed to the risk of pregnancy for 100 years, and if she was using a particular type of contraceptive, let it be Z, how many accidental pregnancies would have happened? Okay, so you will get some number for 100 years. Okay, suppose you got it as 10 for 100 years. Then you can deduct it. So for 100 years, it is 10. That means if she was exposed to the risk of pregnancy for 100 years, 10 accidental pregnancies would have happened. Okay. Then you can deduct it according to her reproductive span. If it is said that her reproductive span is 20 years, then it will be 10 by 5. That means 2 will be the number of accidental pregnancies. I hope it is clear. So this is how you apply. Am I clear? So this is the concept of Pearl Index. But this question was from how to calculate Pearl Index. So we already know the formula. Just substitute in this formula. So in this formula, I'm going to substitute. Here it is said that there are 100 couples. You are, honestly speaking, you are not always, following one single female, but you are always following a group or a cohort. So we have a cohort of 100 couple and they are being followed for 2 years. This is how it actually happens, okay, in reality. So we have, and they have clearly said there were 20 women became pregnant. So the number of accidental pregnancies beyond doubt, it is clearly written 20. Okay, and months of exposure. 2 years means how many months? 24 months, right? Okay, so 12 into 1 year, 12. 12 into 2, 24 months. But 24 months is for one woman. Here you have 100 women. So, into 100. Okay, so 24 into 100 into 1200. Okay, so, or I'll write it in a fresh page. You have seen this, right? I'm taking a fresh page. Look at this, guys. 20 accidental pregnancies divided by 2,400 into 1,200. It was 20, right? Okay. Cut. This 2 cut. 10. So you will get it as 10 per 100 women here. Okay, is it clear? Did you understand? Because it's a calculation part. Usually students get this wrong. That's why I was asking. Okay. Next. In a population with a total of another problem-based question. In a population of, see, 4050 births, 50 stillbirths, 50 neonatal deaths, 150 deaths in 8 to 28. So many numbers, but it's actually very simple. What is the neonatal mortality rate for this population? Guys, neonate means 0 to 28 years. 28 days is neonate, right? So number of deaths which are happening between 0 to 28 divided by total live births into 1,000, right? Okay, so what is the answer here? This clearly said that, see, 0 to 28. Now, what is this 50? If I had that picture, see, here it is said that 0 to 7 days is given as 50. Okay. 50 deaths and 8 to 28 days. 8 to 28 days, how many? 150. Okay, so 0 to 28 days, how many? 150 plus 50. Right? Then, total number of live births. Can I put this 4050? Yes, this is early neonatal, this is late neonatal. Yes, you're right. No, why? Why, Nafisa? 4050 is total, correct? Whereas we have 50 stillbirth. So you have to remove this stillbirth from this 4050. So 4050 minus 50, you will get it as 4,000. Okay, into 1,000. So it is 200 divided by, honestly, I don't know what is the answer. I just put the question. I have to see now. When I do, I'll get the answer. Okay, so it is 50. The answer is 50. Okay, 50 per 1,000 words. Another problem-based question. So this is how you will be getting problem-based question. But the thing is, once you have the concept correctly there, I mean, no one can shake you. Nothing will shake you. However difficult the questions that you will get, it's just simply, and actually, all these numbers will be the ones which you can easily do. They won't give you any hi-fi number. Okay, simply, in your mental calculation, you will get correct answer. Such kind of questions only you will be getting. What is Deva? Oh, Deva, I'll tell you. See, in the denominator, Deva, you are only calculating, you have to put the total number of live births. Haven't I told you, when this many children were born alive in your population, how many deaths had occurred is what you are calculating. So in the denominator, you need only live births. Whereas here, this 4050 is total births, including live births plus stillbirths. And they have clearly said that 50 were stillbirths. So if 4050 is the total births and 50 is the stillbirth, then live births will be 4050 minus stillbirth. That's okay. That is fine. No worries. You will not commit it again. I assure you. Then, according to the national guidelines in India for population size, what is the UPHC? Direct question. Huh. It's 1 per 50,000. See, I told you the range is actually 30,000 to 50,000. If you're asked to pick a range, it is 30,000 to 50,000. Right? But you are asked to choose one, so it has to be 1 per 50,000. And in INI, there were applications of this as well. Like I already told you, in a area, there are 2 lakh population. How many UPHCs are required? So 2 lakh divided by 50,000, because one UPHC is ideally for 50,000. So that will be the number like that. Okay. Yeah. One normal PHC is for 30,000. One normal PHC is for 30,000. This is PHC. Okay. And subcenter, all those things we have seen. Subcenter 5,000. CHC, don't you remember? 80,000 to 1.2 lakhs. We have seen it. You remember, right? Okay. Now, okay, another question from test of significance. Mean systolic BP is compared between 2 unrelated groups. Okay. 2 unrelated groups, that means men versus women. Okay. So purposefully I gave men versus women because sometimes you might be thinking what is unrelated. So here you will be able to understand it. If it is written as unrelated, sometimes they may not give this men versus women. Sometimes it will be directly a group of men, group of women. Okay. Sometimes they will only mention unrelated group. Data are approximately normal with similar variance. It only means that it is normally distributed. Normal distribution. Okay, which is the most appropriate test. That means you have 2 different groups. Outcome is mean systolic BP. 2 different groups. Outcome, mean or average. I've told you it is students t-test. Students t-test. Okay, but there is no such name, students t-test. So what is your answer? Yes. Unpaired t-test is nothing but students t-test. Unpaired is students t-test, right? Unpaired is students t-test. Now, this is something which is a little bit complicated. Actually, this question is not complicated, but I'm going to make it a little bit complicated. I'll come to it. Okay, first let me write students t-test. Okay, before, after, one group before, after. That means same example I had told you when I was taking the LFT, that, you know, there are, I took a group of hypertensive patients. I took their initial systolic blood pressure. I gave a new antihypertensive drug. Then I followed them for 2 months and I said, at the end of 2 months, you are again taking. Oh, yes. Actually, my chart is also running low. I think after this question, I'll have to take a small break because I want to put this in charge. Okay, small break means not much, but a small break. Okay. Anyway, first let me complete this. So one group before, after giving an intervention when you are comparing the mean systolic BP, that is paired t-test, right? So same group. In paired, you have the same group, that is single group. Or you all even call it as related group. It's written like that in your workbook as well. Related group, outcome mean, it is paired. And I said if the outcome is percentage or proportion. If the outcome is percentage or proportion, you can always use chi-square. This is how you write chi-square. Okay, this is chi-square test. Right? So chi-square you can always use when the outcome is percentage. Okay. Guys, I'm going to make it a little more complicated. Before, after, I don't have the table. You have the table in your workbook. If you are having the workbook with you, you will see that table. In a beautiful table, I have given all that. Unpaired are divorced, so 2 groups. Jitun, why don't you join me? We can make beautiful mnemonics. Okay, so unpaired are divorced, so 2 groups. Good. Okay, so pair are together. Okay, so what I was saying is, see, when the outcome is percentage, you can always use chi-square that I have already told you. But before, after, guys, if it is before, after, outcome percentage, it's chi-square only. I'm not going to change what I said, but with a change in the name, a modification in the name, which is McNemar's chi-square. Just go back and see that your workbook, McNemar's chi-square. Though I said it is chi-square, I have clearly written a new name, McNemar's chi-square. Okay. And if outcome is mean, let me write it here. If the outcome is mean or average, 2 different groups, I said, students t-test. 2 different students t-test. 1 group before, after, paired. 1 group is paired. That means before, after. And I said more than 2 groups. What was it? NO1. Do you remember? Now, listen guys, I'm going to give you one more extra point. We have 2 types of distribution. You have normal distribution and abnormal or asymmetrical. Or you will even call it a skewed distribution. Skewed distribution. Okay. In asymmetrical, if it is a skewed distribution, see, you most often you will not get questions from skewed. That is what I'm expecting. But just in case you get a skewed distribution, okay, just in case. The problem is you cannot use, in skewed distribution, you cannot use t-test. Chi-square you can use. You cannot use t-test. Either paired or unpaired. That means t-test can be used. That is the problem. I'm going to write it here. Can be used only in normal conditions or in normal distribution. So, in abnormal distribution, the question was about normal distribution. It was students t-test, but I'm giving you a reserve question for your INI. We are all expecting INI. For unpaired or students t-test, the non-parametric version. Okay. See, normal is known as parametric test. The test that you use in normal is known as parametric test. Whereas the ones that you use in asymmetrical or skewed distribution is known as non-parametric. Okay. So, if the distribution is not normal, we have already seen what is normal, right? This is normal. Sometimes you will not get like this. Instead, it will be skewed like this. Right skewing, left skewing, such things are there. Okay. If it is a skewed distribution, then instead of t-test, that means students t-test, you have to use Mann-Whitney U-test. Look at this, Mann-Whitney U-test. Are you seeing? So this Mann-Whitney U-test is the non-parametric Mann-Whitney U-test. I purposefully put that there so that you will remember that, yes, we have something like that. Man-Whitney U test is the non-parametric counterpart of student's Q test. That means two different groups. Outcome mean, but it is a skewed distribution. Instead of paired, we use, before after is a pair. Okay. So pair means sign is very important. Okay. Before giving intervention, suppose I'm saying that before giving intervention, the BMI was some number. After giving, say, some intervention, the BMI of that group has changed to this much. Okay, so you would like to know whether it was an increase or decrease after giving intervention, right? So what I want to tell you is when you are comparing pairs, sign is very important. Okay, sign. Okay, so name of the testers, Wilcoxon sign rank test. I know I'm confusing you guys, but these are reserved questions just in case. My intuition always works, so that is why I'm giving you some complicated yet expected questions. Okay. I'm done. Okay. So these are the non-parametric counterparts of paired, and this is in short, paired and t-test when you are dealing with skewed distribution. With that, I'm finishing the first 20 questions. I hope you're with me. Okay. Okay, guys. So can I? Yes, Adarsh, in skewed distribution, you will not consider mean. Instead, it is median. That's right. So shall we take a small break, 5 minutes break, just for, just charging, not even 5. I'll take very short. You can also take a tea. This is charge is less. I want to charge it. That's right. Okay.